So radioablation is a really fabulous approach for anyone who wants to get rid of a benign growth that they don't like, for example, because it's on the face or in a prominent area or it rubs on underwear, whatever the reason is. So we need to make sure, first of all, that that's totally innocent. So in our practice, a doctor with experience and expertise in using a dermatoscope will first examine that particular lesion or spot and make sure it's totally innocent. And then a probe is basically passed through that. It works a little bit like a hot knife through butter, dissolves the tissue away. Our nurse practitioners that are then using the treatment use a little feathering technique to leave a very smooth little sore behind that is then covered and sealed with a band-aid and allows quick healing. And generally, on the face, the area might be covered for a week, on the body maybe for a couple of weeks, and we keep it covered so it's in a nice moist environment until it's fully healed, which gives us a better cosmetic outcome. We can use this treatment for a benign growth like skin tags, warts, what's called seborrheic keratosis, or sometimes people refer to them as senile warts, and any moles that are growing and are annoying for whatever reason. Generally, we see an absolutely fabulous cosmetic outcome from these treatments. So 99.5% of patients after a few months have difficulty remembering even where the lesions were because the cosmetic outcome is so good. I myself have had 3 or 4 moles removed from my face, and I have difficulty remembering where they were. But of course, we do consent people properly. It is possible sometimes that we get unusual healing, so we always want people to come back and see us if they're at all unhappy, because there are other things that we can do to improve that cosmetic outcome should there be that unlucky 1 in 200 that ends up with an outcome that is not altogether favourable. People, please don't let beauticians or massage therapists remove your spots without them being examined, because truly it could be a skin cancer. And with some skin cancers, if they're removed in this way, they can grow underground and come out much more aggressive and be a much bigger problem to deal with later when they then reappear. In our own practice in Townsville, we would remove up to 6 spots in one sitting. The reason for this sealing is that we want our practitioners to be fresh, to be able to concentrate fully, and we are found in the past, if we allowed 12 lesions to be removed, then people are much more likely to come back and need second treatments on those last ones. So we have a sealing, definitely, so that we can provide the best possible care for everyone that comes to see us. In terms of recovery, it really depends on how you personally feel about having a band-aid that's visible, say, on the face. Many people don't mind at all and will go straight back to work or straight out to social engagements. If you do feel embarrassed about that, you might hide for up to a week until it's removed.